All right, good morning, everyone. Thank you and welcome to our session, panel discussion, KL2 and TL1 Mentored Research Experiences in Translational Career Development. We have a fantastic panel for you today of previous KL2 and TL1s. We're going to give a little bit of their background, what the award meant for them, and where they are in their careers today. And we want to leave some time for questions in the audience if you have any questions about KL2 programs or the TL1 or just moving forward in translational research. This is the panel for you. All right, we'll get started.
Thank you, Holly. I'm Charlie Bengston. I am an assistant professor in the Division of Pulmonary Critical Care and Sleep Medicine at KU, and I was a previous postdoc TL1 awardee. And so a little bit about my background. I was working through residency and fellowship after medical school, and had a little bit of research experience, pretty brief, just with all the clinical training. And as I was coming to the end of my fellowship and deciding, exactly what I wanted my career to look like, I realized that I wanted to have at least a footprint in research, and I was searching out ways to do that and talking to some of the folks in my department and division who were mentoring me, and they really recommended getting some sort of funding to, prolong, I guess, my training. And there was a couple different mechanisms which to do that by. And so I was looking at several, from, NIH, they have kind of F32. There's, from foundations that most of my research is focused in cystic fibrosis, so they have a mechanism. And then also Frontiers has the TL1. And so I applied to several, and Frontiers was the first I heard back from and got the award. And so, that really gave me about 2 years of protected time and extra training to really focus on developing my, research background and clinical research training to really set myself up for, what's hopefully a long career in clinical research. So my time in the TL1 was great. I met a lot of great people, and I think one of the biggest things was just, you're so siloed in clinical training that I just didn't really know a lot of the other people in the institution and what they were doing research-wise and how they could help me, how I could help them, and how we could learn from each other. And so some of the people I was in the TL1 with, I still, collaborate with today. We've submitted grants together. And, Dr. Leader, which I think he was in here a little bit earlier, was my advisor on the TL1, and he's turned into my advisor on my, my next career development grant. And so really a lot of good relationship building, learning what's out there, learning what resources are available. So after the TL1, I submitted a couple different grants. I submitted a K23, and the first round didn't get funded, and revised and resubmitted, and that was funded a little under a year ago. And so currently working on that research project. The other interesting thing, unfortunate maybe, was, right in the middle of my TL1 was the beginning of the pandemic. And so my original TL1 project kind of was derailed because of stoppage of research, and, I think it had some, technical roadblocks. And so, I, being a lung doctor, got involved more clinically during the pandemic, and then there were also a lot of other research opportunities related to COVID, and especially clinical trials. And so I thought, that was a really good experience for me to have something kind of outside of my primary area of research that, helped me learn a lot about clinical research very quickly. And it has also led to a lot of other opportunities in kind of like a parallel track where, I've gotten to work with some, national, international clinical trial groups in COVID-19 and form some relationships there. So I think, just looking at opportunities along the way to where you could branch out and not overload yourself, but, just other avenues which, if your primary research area doesn't work out or the project, doesn't have the results you expect, that there's other things that you can keep moving and propel your career forward. And so that's kind of my story in a nutshell. I'll let Amanda talk.
Hi, I'm Amanda Szabo-Reed, and so I'm a little different. I'm not a clinician scientist. I'm actually just a PhD scientist. So I came to the University of Kansas Medical Center in 2012 after graduating with my PhD in exercise psychology. I then received an F32 from NIDDK to look at the effects of weight management interventions on cognitive function in middle-aged individuals. After that, I sought out the KL2 kind of as my next stepping stone, and I wanted to expand my work on cognition in weight management kind of settings to look at how metabolic syndrome was associated with cognitive outcomes in older adults. My previous research as a doctoral student had been primarily in older individuals, so it was kind of linking everything that I'd gained from my postdoc experience with my PhD and linking it back to that. And so through the KL2, I was, as mentioned before, able to meet a lot of different individuals on campus that I wouldn't normally meet within my own department. And I also was able to complete the Master's in Clinical Research program, which I have found to be very beneficial, and now I actually teach as part of that program. So it's kind of come full circle there. And then now I have an R01 looking at not weight management, but exercise and the impact of exercise on cognitive function in older adults, specifically interested in resistance training and combined exercise training. So looking at the impact of aerobic as well as resistance training and how does that impact cognition and brain health in older adults.
Okay, well, I'm going to follow that up with someone who didn't quite go into quite the same high-powered research direction as everybody else next to me. But I actually got my T32 in 2011. I think it was the first year of the program. I used that was at the end of my second year of medical school at KU, and I ended up using that to get my master's in public health and to pursue research with the Department of Pediatrics in the Department of Pediatrics in the section of behavioral pediatrics or psychology. I worked with Dr. Susanna Patton, who is not here anymore. She's actually in Florida, I think, now. And we were doing research on psychosocial factors impacting glycemic control in type 1 diabetic youth. I had a sub-project then that I did as part of that, actually looking at rural access to standard of care, because as part of the cohort that we were recruiting for her study, we were able to travel to western Kansas, to more rural parts of the state, to actually see patients. So that was what I did as a part of that, in addition to funding my work as a master's in public health. Since that point, I went on to do my residency in pediatrics and then a fellowship in pediatric rheumatology, so I left the diabetes world. And have continued to be active in research, although, again, to a lesser degree. I at one point jokingly said, well, not actually jokingly, I said I wanted to be 80%, or not, sorry, I wanted to be 50% research, 50% clinical, and everyone laughed at me and said that doesn't exist. You're either 80%, like 20%, or it just doesn't exist. And so I decided at that point kind of that research and applying for grants all the time was not my thing, but I still wanted to be active in doing research. So I have continued to do stuff. As a fellow, I actually did work looking at psychosocial factors in parents and disease activity in lupus in pediatric patients. I have not published that yet. And then since have continued to do some stuff and am currently working on some projects looking at pain and working with some of the psychologists to look at pain in youth, because as a pediatric rheumatologist we see a lot of pain syndromes. What else can I say? I think that's mostly it. I guess I forgot. I didn't introduce myself. I just started talking. I'm Brad Nelson. I'm at KU. I'm a pediatric rheumatologist. I also do general pediatrics as well. So a little bit different story. I think it was a very valuable program for me. Again, it helped fund part of my education, and it also helped get me a foothold in the research world. And even though I'm not pursuing that as my main, I'm mostly clinical, which is what I really enjoy. I still do enjoy research, and it's allowed me to continue to do some of that as a kind of a part-time thing.
So, hi everybody, I'm Jen Villwock. I'm an associate professor in the Department of Otolaryngology, Head and Neck Surgery, and so I'm one of the surgeon scientists in the department. I think similar to a lot of the other clinicians that are on the panel, like we take a research class, or at least I did in med school, but it's like 6 weeks, and it's like, how do you calculate sensitivity? And that is it. So I think for me, you know, one of the values of being a participant in the KL2 program was that it actually gives you the opportunity to really think intentionally about what your, I don't want to say deficits because that sounds like self-deprecating, but kind of where your biggest areas for improvement are, and to delineate, you know, the way that you would like to address them. And so for me, you know, my background, so I came to KU in 2016 for fellowship, and so my clinical fellowship is in rhinology and anterior skull-based surgery, which means that I primarily do surgeries through the nose with cameras and address things like chronic sinusitis as well as skull-based tumors. And I was very interested in a variety of different things. And so I think one of the benefits of the KL2 program was that it allows some time for exploration in which you're kind of away from the clinical grind. So you have some time to really define what it is that you're interested in. And so, like when you read my NIH bio sketch, because I remain interested in a variety of different things, it says that my unifying research theme is accessible innovation, because where most of my research comes from is I see these clinical problems, and a lot of times in clinical medicine, you do things just because that's how you've been taught, or because no one has come up with a better way. And so a lot of my research centers around, well, how can we develop an accessible, better way to do things? So currently, my two main areas of research are one in olfaction. So as someone who primarily does a lot of work in the sinuses, we know that sense of smell is important and can be a predictor of, you know, inflammatory disease in the nose, so things like nasal polyps, et cetera. But as I learn more about things, olfaction is also very important in terms of being a window into cognitive health. And so, you know, at this point in time, I have an R01 investigating the use of olfactory phenotypes or patterns of olfactory performance on cognition. And can we use non-invasive olfactory testing as a way to screen for Alzheimer's disease? And so we're comparing our olfactory tests that we developed at KU, because I got frustrated because all the other ones were like super expensive. Like that's the reason why when you go to your primary care doctor, you don't get a screening olfactory test, because it's super expensive and there's no billing code. And so we said, well, it doesn't make sense to not do something just because people made an expensive test, so let's make a cheaper, better one so that it could potentially be scalable. And then going back to my fragmented interest, the focus of my KL2 award, though, because I wanted to grow in the realm of qualitative research and mixed methods research, was investigating perioperative pain, because as a surgeon, I care a lot about that, and a lot of the assessments, at least on the clinical side, didn't make a lot of sense to me. Like when I'm on call and someone pages me and is like, this person's pain is a 12 out of 10. Okay. Like it doesn't give me any functional information or any information upon which to actually make a decision. And so we were studying a biopsychosocial model of perioperative pain, as well as piloting a novel infographic-based pain scale that linked pain to function. Because for me, at least as a surgeon, I care about what can my patients do, and does their lack of ability to do certain things put them more at risk for not being able to be discharged home, for a perioperative complication, DVT, pneumonia, et cetera. And so those are the metrics that I cared about, but we wanted to make it easy for people to not only complete it, but also for the people who are then reviewing that information to get the information that they needed out of that assessment very quickly, which is why we shifted to a visual format. And I think for me, if you want to pursue, a career in research, one of the things that you have to work on a lot is your grant writing. And I think for me, one of the most beneficial components of the KL2 program was participating in the grant writing class. You can get like the grant writer's handbook, or that's not the actual title, but whatever the NIH grant writer, the thing that you're supposed to like make sure that you follow all the rules for. And what I found, because I had submitted my first RO1 prior to taking this class, and I thought I followed all the rules in the book. And then after I went through the class, I would hear folks like Ed Ellerbeck or Kim Richter, and they'd be like, oh, if you don't put this specific sentence into your grant, you're going to get dinged. If you don't consider these things and make sure that it's clear to the reviewers that you thought about those things, you're going to get dinged. Yeah, and lo and behold, got that summary statement back, and I was like, yes. Every single thing that they said that I thought I followed the rules, I got dinged on, and my impact score, I don't even remember how much it improved by, but it went from like barely squeaking by to getting discussed to funded on the revision. So I think that's kind of the power of having mentors who can actually go through, make sure that you are saying things in a compelling way, checking all the check marks to really set you off on a trajectory for success. So we have that RO1. Now we just got recommended for funding through a Department of Defense grant, so we're going through that contract negotiation now, and those are both related to olfaction. And then I just submitted last month another RO1 related to the perioperative pain work. So that's also my spiel to say that you don't necessarily have to just pick the one thing, I guess, that you care about the most. I'm just continuing to see how I differentiate over time and kind of where there's success and where I stay interested, and letting that guide my career trajectory for now.
I love that. So tell me a little bit about each of you, how you identified a mentor in a project when you first submitted your application.
Yeah, so I think for me, there was not a lot of people in my division doing clinical research, and so that sort of funneled me into CF, cystic fibrosis, and so that's, and then, as I was thinking about applying, we had people coming from outside who brought more of a translational research focus, and so just timing-wise, it really worked out well for me, and so Dr. Matias Salate, he's my primary mentor, and is on the TL1 and my subsequent grants. So it was a little bit about timing, and I think also just, having some initiative and showing that, this is something you're interested in, and, when you, completing the tasks and showing up and being there just really, I think is a big statement, and that makes people want to mentor you. And so I think that's kind of half the battle, is just putting in the work.
So one opportunity that I wanted to get through my KL2 experience was multi-site clinical trial experience. And so I sought out a mentor. His name's Jeff Burns. And then I continued to work with my F32 mentor, Dr. Joe Donnelly. And Jeff Burns was currently involved in a project called Ignite, which is investigating gains in neurocognitive function in older adults. It's a 680-person older adult trial at 3 different sites across the country. And so that really gave me the opportunity to see how to start up, build, and really go through the quality control processes that are associated with multi-site clinical trials. And so that was really why I picked my mentors, was because of that opportunity.
Mine's kind of, a little more roundabout too. I had done some work in the free clinic in diabetes for a period of time, and so I had been doing a lot of work actually in adult diabetes, and decided that I actually don't even know how I ended up meeting, but I met a pediatric endocrinologist that I enjoyed working with, really had a great time, thought he was a very good teacher, and so I kind of approached Tim when I was doing all this, and I said, hey, I'm really looking at doing some research and stuff. Do you have any thoughts? And he introduced me to Susanna Patton, who was very excited to have somebody else join, work with her, and she an amazing mentor. If I couldn't recommend her more if I was going to really be a high-powered researcher and write grants and stuff. She does a lot of amazing work. So introduced me to her, and we've kept in touch a little bit, and even though she's moved, but that's kind of how I ended up where I ended up.
So I found my primary mentor for my KL2 actually through some of the medical students that I work with. So a lot of our research teams in our department have a lot of trainees at all sorts of different levels. So whether that's clinical fellows versus residents versus medical students. And, one of my goals as an educator is always to, get my students in touch with the people and the mentors that they need, really make sure that they're presenting both locally as well as at some of our national conferences. And one of my students was presenting on the pain work that we had been doing at a local conference. And, he was standing by his poster, people were coming up to him. And one of them happened to be Barb Polivka, who is the dean for research at the School of Nursing. And he was, just relaying the study results, et cetera, and she was very interested. And so that sparked us then, meeting to see what sort of collaboration or what more enthusiasm and future research studies we could do together. And then and once I met with her, I'm always very interested in expanding my perspective, to some of the other points. We tend to really focus, especially when you become like sub specialized just in your little field. So then you only know what the other people who have trained exactly like you are thinking, which is not exactly helpful when you're trying to develop new and novel things. And so I was really committed to having Dr. Polivka as my mentor because obviously the nursing perspective is very important for things. She has a lot of experience doing clinical trials as well as things that are involving qualitative research and home-based interventions. So the skill set was something that I gained valuable knowledge from her about, but more so I think it's about perspective and connections and just thinking about the same clinical problem from different perspectives that you might not be aware of. But yeah, I owe it all to my student David Warnke for presenting at that conference and making her enthusiastic enough to want to meet with our team to see what else we could do together.
Thank you so much. I have a few more questions, but I want to open up to the audience. Does anyone in the audience have a burning question for our panel? Don't be shy. I'll just start calling names. See you.
So, I have a question for Amanda. Basically, I think you said you have an R1.
Yes.
Oh, thank you. So, in that grant, I think you have like a patient, subjects, like they are older people. Maybe you just wanted to evaluate the effect of exercises on their healthy, maybe. I mean, this is like a human participation. How this is called R1, not a clinical trial?
Oh, yeah. So it's an R01, so it's a randomized clinical trial. So the goal of the trial is to randomize 280 older adults into 4 arms of exercise. They exercise for 1 year, so they either receive resistance training 3 times a week, aerobic exercise 3 times a week, or a combined resistance aerobic training, or our control group, which is an active control group. They do some yoga type exercises. We have them exercising out in the community, so we contract with the YMCAs and train the trainers to deliver our intervention. I also have someone who oversees quality control. And And then we see them at 3 different time points. So baseline, 6 months and 12 months, we collect cardiorespiratory fitness as well as a variety of strength outcomes, and then do MRIs to look at brain structure and function and cognition. And we repeat those assessments at 6 and 12 months. Did that answer your question?
Yeah.
Okay.
I had a quick question. Should your mentor be from your primary institution? That could be for anybody.
I think it's important that at least your primary mentor is at your selected or your home institution. I don't think all of your mentors need to be at your primary institution. I think in some cases you can't complete your research without bringing in outside people. For example, we don't have individual smart designs and are really popular or adaptive designs, and we don't have people on our campus who really have the adequate training to do that type of thing. So I think seeking individuals outside of the campus is just as important as who is on campus. So.
Anyone else want to take that?
Yeah, I would agree. I think, having a primary mentor or at least a strong advocate in your home institution, because there's a lot of sort of, as you're developing your career, a lot of, local, I won't say politics, but, how to navigate that transition at your local institution. So somebody that can help you there. And then, if your primary mentor can be somewhere else, or, if you have a content expert you need that's not at your institution, I think that's really valuable to look outside and make those connections and build, long-term relationships.
I can just respond to that question too. So my name is Matt Mosconi. I'm part of the KL2 program currently, and sit on study sections reviewing K awards. And so just have some thoughts on that question. It's a good one. It absolutely is the case for 5-year NIH, 4-year, 5-year NIH K awards that there are strong candidates and strong proposals that do get funded that have a mentor who is at a separate institution. I think what's key there for those, it will almost always get discussed, like how is this going to work, is that there is as our speakers were referencing, that there is a clear plan, that there's support at the home institution, and then there's a very clear, fully fleshed out, detailed plan of how that mentorship is going to work, and being upfront about the obstacles of there being distance, how that's going to come into play, and how you're going to address those potential issues. So if your question is in regards to like an NIH-funded K, 01, 23, 08, then I'd be clear about that. For a KL2, it's a little bit tougher, right? Because it's more circumscribed. And then you want that primary mentor and that primary support at the home institution, though separate co-mentors or contributors are welcome from other institutions.
Thanks for the panel. Actually, I'm Dr. Arjunan. I recently moved from Georgia last month. Actually, my first RO1 got scored in the first submission, but not successful in the subsequent submission during the pandemic situation. So what I noticed was the first submission, there are different program officers. Then subsequent submission, they changed to another program officers. But however, I realized and I checked with them, they said that you can resubmit because of the pandemic, all the funds goes to COVID. So your proposal is very unique and novel, but you can resubmit. Then I most probably get funded. Then my concern is, this is a usual process. Once you submit it, they will keep on changing the program officers, or the only one program officer will take care of that proposal.
Oh, I think that kind of stuff happens all the time, and I mean, it's just like at any institution or anywhere. Program officers or different people on panels change all the time. I think the important thing is just being in contact with the new program officer that you're going to be submitting to and making sure that this person is still in line and interested in your research. Because at the end of the day, when it goes to council, they're the person who is going to be fighting for your proposal. The reviewers do have a say, and council does read those reviews, but at the end of the day, it's the program officer that's fighting for your proposal to get funded. So I would just reach out to that new program officer and be in contact with them and be like, here, this is what I'm interested in. Sometimes they can give you pointers that would make your proposal more of interest to them.
Yeah, and they should be providing guidance as well. So if there's been some sort of transition or there's been some shift in what the priorities are, they should be able to help direct you, to make sure that things are being submitted to the correct, mechanism and going to the correct study sections as well.
Okay, thank you. Actually, they suggested to split into two proposals. One, because it's combined for me is basic and translation research. They asked me to split into two, and I'm submitting as a new submission. So that is the thing I heard from the program officer, but after that, I didn't get any information about that. So is that way can go with that two proposal or combine both?
It's hard to comment on that without knowing the more details about the proposal and what sort of communications have occurred. I think sometimes you may want to think about trying to be strategic about your inquiries to the program officers as well. So keeping in mind what the standard submission deadlines are, things are going to be very busy around those times. And so you may have to send several emails or requests for meetings so that you can actually lock down a time or get some more formalized guidance about your specific questions.
Okay, thank you.
There's someone.
Hi, thank you so much for sharing y'all's experiences. I had a really broad question, so it's really for anyone. I know a lot of you talked about how the Frontiers program, whether it was the TL1 or the KL2, helped you foster like relationship building within your institutions, but also beyond it for research and the importance of others' perspectives. And I'm just curious how the program gave that ability for you to make those relationships and connections.
Yeah, I think one of the mechanisms, one of several, we had sort of, when we started in the TL1, when I did, meetings and went to lunches and dinners and everybody just got to meet each other in a very informal environment, which I think was great. And then we have every month, Frontier Scholars Clubs.
Every 4 weeks.
4 weeks, yes.
It's exciting. You should come.
Yeah, and so those were actually really, really good. There were grants discussed that are going to be submitted and comments back to people and people presenting their research. And so that was really where, and it was all just K&T and the advisors. And so very low stress environment where you could meet people, talk about research, exchange ideas, and I think built a lot of relationships that way.
Yeah, I would definitely agree that the Scholars Club was definitely a really good area to present your research because all of us did very unique things. There was no two people doing even close to remotely the same thing, so it was really nice to get a very outside perspective from someone not in your field. And it was also very helpful for explaining what you were doing. Because if someone outside of your field can understand what you're doing, hopefully people on study section can understand what you're trying to do, or people outside of the institution. So.
Yeah, and I think sometimes, when you think about the research that you're doing, you're looking for like a specific set of expertise or a specific perspective, and you can kind of articulate what that need is, but you don't necessarily know who the person behind it is. So in addition to some of this peer and near-peer mentorship that you just heard about, I think one of the things that's really important is that a lot of the folks that are either serving as mentors or part of the more formalized kind of faculty as part of the KL2 and the TL1 programs, they have a much broader view of what's going on as an institution. And, I think as a trainee in those programs, you're kind of like pre-vetted, so you're not just like the random person who's like emailing everybody at kumc.edu to try and find a mentor, right? Or to try and find that skill set. So they can very efficiently kind of plug you in with the people that might fill that specific need and have an idea of not only whose resume looks good on the website, but who is a good mentor, who is being productive, whose trainees are doing well longitudinally, which I think can really save you some time as you're thinking about your own career progression and how to really maximize those relationships.
Thank you.
I'll give you one. What's your best networking tip? Put you on the spot. It's got to be really good.
I can answer that one. I mean, I think for me there's two. So one is when you're meeting with someone new, such as the person that your mentor, one of the faculty just put you in touch with, be able to articulate the answer to the question, how can I help you? Because that is the first thing that people are going to ask you, and if you don't have a great answer for that, it's going to be a really awkward, 30 minutes of your life as you try and figure out how to fill that 30-minute Zoom meeting slot. So have an intentional, thought-out answer to that. And I myself tend to be very introverted. I was just talking with my chairperson who was like, I want you to get involved in this society. It's really great for this, this, and this, and they throw the best parties. And I was like, well, for me as an introvert, the best party is the one that I am not invited to. But when you're thinking about, being in situations where maybe you don't feel comfortable, I think one thing that's important to keep in mind is what is the purpose of that interaction, right? So because of my personality, I don't necessarily relish sitting on panels, right? But I feel like I got a great deal of value out of the KL2 program, so I would like to be an advocate for that experience and all the other resources that Frontiers has, because what I care about is the research that all of us are doing, right? So those are the things that kind of link what I care about to whatever the tangible action is. And so whether that's like a networking event, my kryptonite, right? But I can set a goal for myself, and I'm a goal-oriented person, so I can say, all right, Villwock, your goal at this meeting is to meet one new person and learn about whatever it is that they're interested in. Then it's not just your goal is to go stand in the corner at this networking event and make it a half hour, right? Those things have a very different value, and so I think figuring out what's meaningful to you can be very helpful in any of those networking type situations, if you're like me.
Facebook, best networking.
Hey.
I'm just kidding. No, I think I was just going to say too that I think being open to just meeting all sorts of different people is the best networking tip I can give. I know it kind of sounds cliche, but I think that there's a lot of stuff that you'll find in people that you meet with that you may, even after reading their bio sketch or whatever, you've decided that you're probably not interested in the things that they're interested in. But then you'll find that actually after talking with them and having a conversation for a little bit, that they do have some stuff to offer, and that you may have some interests that overlap. And so I think that being open can be very helpful. So.
Yeah, and sometimes prepping, if you know a certain person's going to be at a networking event that you want to meet, I think prepping to talk to that person and making sure, because you may only get 30 seconds with that person initially, is making sure that you have the questions ready that you want to ask that person, and hopefully that you can make that connection. Because, like I said, sometimes you only have 30 seconds with that person unless you can get them for longer. So.
Yeah, I don't know that I have any other grand ideas, but I think I agree, with Amanda and Jen, having sort of a discrete plan of what you want to ask the person, what you want to request from them, and just be prepared when you go in, because, it's hard when, these are busy people, and if you have a 30-minute block scheduled and you're not prepared to talk, it can be, start the interaction off on a bad foot. So I think if you come in and are prepared, it makes you, look a lot better.
Any burning questions in the audience?
Yeah, so I have a question. So if you're applying, so I'm currently a TL1 pre-doctoral trainee, and like if I want to apply for a K award, but like for me, like I haven't, like I'm a pharmacy student, so after the TL1 pre-doctoral trainee, I have to go back to the pharmacy school to complete school and then residency. So there will be a gap between TL1 and if I'm applying to K award. So within that gap period, do you have any advice to still keep the connections and any updates, like if we want about the programs and how to involve in research even within these pharmacy school, like any advice for it?
Not me. I'm not a clinical person.
Yeah, I think, just being intent as you're going into, back to pharmacy school or looking at residencies, being intentional, when you're applying for residency, make sure that you're seeking out programs that may give you time for research, knowing that, the focus is probably more clinical, I think is important. And then, just trying to keep some, I guess, irons in the fire, so to speak. So keep those connections open. Try to stay as much as you can engaged in some of these projects so that, when you do come time in your career where you can apply for these kind of next stage grants, that you have things ready to go and projects that can be restarted.
Yeah, and I mean, I'm not a clinical person, so I can't really speak from that, but I think working with students that I've had the opportunity to work with in the clinical setting is, keeping contact with your current mentors, and even if you can't actively be involved in the current research heavily, still doing publications I think is a really important way to keep your CV up and keep showing that you're interested in clinical research, and then just even coming up with new ideas, because maybe down the line they might be able to add you to a grant, I think are just ways to stay involved.
And you can do things too, like set a calendar reminder for yourself. Like I need to send these people an email just to be like, hey, I'm still alive and here's what I've been up to. Or for those whose groups do, routine lab meetings, even if you don't have anything new, just showing up is half the battle, for a lot of things, because you get out what you put in. So I think if people see that you're continuing to show up and contributing meaningfully, asking questions, even if you're not at a stage where you have the bandwidth to execute whatever the next step will be, it just shows that you're maintained interest and enthusiasm, which will be very helpful, when you're looking to those folks for writing letters of recommendation or whatever the next ask will be.
Thank you so much.
All right, let's go back to grant writing and project management, and what's your best tips for when you're writing and about to submit a grant, that you keep on track and stay to those deadlines?
Well, I'm a chronic procrastinator, so I'm always sending our research folks, documents on the last day. So I'm not the best person to ask. But, I think, having other people read your grant and provide comments is really important. And looks very bad if you do this, a week or two before the deadline. And so just setting a longer, 6 months out, set a deadline of 1 month before it's due, to at least have a rough draft out to people that can look and comment, and then gives you time to meaningfully reflect on their feedback and incorporate changes.
Yeah, I think that's a really good point, is making sure to have adequate time for people to give you comments. But so I'm probably a bit different. I submit probably somewhere around 6 grants a year to the NIH. Not all of them are funded, obviously, but it's a work in progress. But I think just making sure that you have a strict timeline of what you need to complete, so that you can get your things into RI with their adequate deadline that they request. And then the other thing that has really helped me is always working towards the next deadline as well. So thinking about, come June, I have these 2 grants that are going to go in on June 5. What's my plan for October 5? Do I have the next idea? Do I have another group that I'm starting to kind of collaborate with to get a proposal together? So kind of thinking one deadline ahead of what I need to think.
Bless all the primary researchers out there. This is why I decided not to be a primary researcher. Not working deadline to deadline for those submitting those things, but I do think it is important, yes, when you got stuff to have time set up before. But I'm not going to comment a whole lot on it because I'm not the one in there submitting those all the time. So,
Learn to love grant writing. I inherently love grant writing, so that's like easy for me to say. But yeah, it's a skill set that has to be cultivated if you want sustained success on this pathway.
Thank you. I am Baki Agbas from Kansas State University. It's not a comment, but to share the information with you that the Frontiers providing the mock NIH style review. It's really good. It's the true NIH style. Get very speedy, 10 minutes. Then after you can communicate with a primary reviewer, then they can get more into details. I did that one, actually, for my R15 grant. Then it was reviewed, and I made a comment. And then after, I contact with my primary reviewer. And then we went through almost 1 hour in detail. Reason is that when you submit through the Frontiers, it's a kind of I hate to say an obligation, but it's a set things that they have to meet and they have to write the report. But I am giving to my grant application to my friend, he is also busy. He's also busy, and I will make a very quick, I think, but if you are submitting through the Frontiers mock NIH style reviewer, I think this is very good service. I really like it.
Yeah, I would agree with that. Like, if you have the opportunity to complete your grant ahead of time before the deadline and put it into the to the Frontiers review, mock review, do it. It's definitely well worth it. I actually had one of my case submissions reviewed when I was a case scholar through the mock study section, and it was really interesting to sit and see how study section ran. And then, this, I think, the mock study section that was in the fall, I reviewed for. I unfortunately wasn't able to sit on the panel because I was on maternity leave, but I still, it was really nice to be able to provide feedback to somebody, and I was hoping that they would disclose. I don't know if they ever disclosed who reviewed the applications, but I think it's helpful to have those conversations because that's not something you get to have through NIH. You don't know who reviewed your proposal, and you can't have a conversation with them about why they provided that feedback.
Mock study section for this spring is actually open right now, accepting applications through Frontiers. So if you have an application that you'd like to submit, we do R's, K's, and now F's. Thank you, Heather. And I also want to highlight, we have here at Frontiers a biomedical writer. Heather's actually sitting in the back. She's fantastic. If you want help with your application or need help with a presentation, she's a fantastic resource at Frontiers as well. Heather, do you want to introduce yourself?
I don't know what else to say beyond what you've said, but yeah, I'm Heather Fielding Gebhardt, and I am available to anyone who's associated with Frontiers for all kinds of biomedical communications, science communications, grant applications, publications, all of that.
And she's a rock star, just saying.
Thank you.
Is this only for Frontier-related applicant, or is it applicable for anyone?
Any.
You just need to be a Frontiers member, so just make sure that you're
free to join.
And it's free to join.
Real quick application, free to join. Services are free as well.
I had a quick point on that front too, which I also would advocate for the mock study sections, but I think as one of the speakers pointed out, sometimes the timing doesn't line up perfectly, but I'm a strong advocate also for getting, as one of our other audience members just pointed out, for getting good critical reads. I once had somebody, a more senior advisor, tell me to get a friend to read it and pay them $100. That didn't work out well. It usually involved $100 plus a few dollars for a pint of beer, and I didn't get much criticism. So I would discourage you from getting good friends to read them. But what could be helpful is there may be other options too within your institution. I'm from KU Lawrence. I know KU Lawrence will pay $500 and they'll coordinate the external reader, and you'll get good criticism. They'll pay the $500, they'll get a good read, and you'll get basically a full NIH-style critique of your grant. And it's a more flexible timeline. Like you can do it, they just have to get it back to you within a month of your grant going out. So, but I would explore that within your institution. There may be other options to get good critical reads ahead of submission.
Yeah, I would encourage, F, I guess now, and K applicants to do it, just because the NIH grant review process is sort of this very mysterious thing the first time you submit to them, and you don't know, it's going to this place, and then it goes to this place, and this study section, and so I think using the frontiers, since they use the NIH style, really helps kind of in your mind conceptualize what's going on and how to walk through it when you actually submit your grant and get feedback.
And even if you don't have an application to submit, if you would like to apply to just observe the study section, to be in the room and observe how it works and what happens, that's available as well. And you can reach out to myself or Heather, and we can help you with that too. That's a valuable experience too.
I would definitely agree that just seeing how study section operates is a very good experience, especially for K and T scholars who have not submitted a proposal to NIH before.
I have a last question regarding TL1 application. Just say that you just received a TL1 and you are in the middle of a postdoc, like postdoctoral year 4 or 5, and you want to get sorry. So my question is regarding TL1. Just say, for example, I got TL1 and I am already in the year 4 or 5 of postdoc, where I feel that I need to go to higher level. In that case, what happens to TL1? Just I lose it, or how does that work?
I believe, so if you move on to a different institution, obviously you won't be funded here anymore. I think, you can't move from the TL1 to the KL2 automatically. So I mean, if you feel the need to move on, then I think you move on to a different position, because the TL1 is for postdocs and predocs, it's not for faculty. So unfortunately, you lose that award if you
So within the same institution, just say taking a transition from a postdoctoral fellow to research assistant professor, the day you get promoted, you lose it, right?
I think so, yeah. Mm-hmm.
It has to do,
with the
it goes
NIH.
with NIH requirements as well. It's
Yeah.
not necessarily standards we set, but standards that have to do with it.
But that doesn't mean that you can't apply for the KL2 once you have a faculty position or before.
All right, last parting wisdom to our group. Anything?
Keep writing grants, lots of grants.
Stay curious. Pursue the ideas that you think are both fun and impactful. I think that's what keeps things the most fun for me.
We have another question.
And the first part you have mentioned about you have been mentored quite well, so now you are in the mentor status. How would you do it differently to your mentors, to mentees, I'm sorry?
You stumped them.
Yeah, I think that there's different paradigms of mentorship, and I've had this discussion with some other folks as I'm trying to figure out how to be a better mentor and facilitator of other folks' research. And so the approach that I have historically taken, which maybe is not the most effective, is that I am most interested in what my trainees are interested in. And so that leads me to supporting them on journeys and subject matters in which I am not necessarily a content expert. So a lot of times we're kind of learning together, trying to figure out who else to put on the team so that they have an effective team that can help them towards whatever that scientific goal is. Now, I wonder if that is just because, as we mentioned before, as clinicians, we don't necessarily have like a great research background to start with, which leads us to have pursued oftentimes publications in a numerous, variety of different clinical domains by the time we actually become faculty. My perception is that there is another school of thought where folks are much more aligned, like this is the research that I do, here's little tidbits of what I do, which may, it may decrease kind of the onboarding and on-ramp for these sorts of ideas, and having people gain foundational skill sets that way before they pursue their own independent ideas. I don't know if there's any conclusive evidence that one way is better than the other, but I just perceive that sometimes I may be the rate limiting step as I'm trying to learn with my trainees about the things that they're interested in, as opposed to just having them do the stuff that I already do.
So I think about it as I've had mentors very different from myself. And so I try to be, especially to other women in science, a good mentor to them, because I've had only male mentors, which is kind of interesting. But that's because there aren't as many women in science, especially from the institutions I came from. It was very much the minority. And so I would say most of my mentees to date have been other females. That's not to say that I couldn't mentor a male. So I just try to encourage women to, get engaged in science and, stay engaged. And so another thing I try to really work on is providing connections and networking and helping to facilitate those connections and those network connections, because again, that was something that was not done for me by my past mentors. They, in rare occasions, would introduce me to somebody, and so that's something that I've really made a point to do, is help introduce and foster networking opportunities for my mentees.
Yeah, let me build off that and just kind of my last parting words of wisdom. So, everybody in this room is very smart, but, nobody, it's hard to get things funded on the first time. Rejection is part of the job. And so don't get frustrated or discouraged if you're resubmitting grants, papers. And so, if you work hard, the opportunities will present themselves. And I think a lot of really successful people in academic medicine will say that a lot of it is luck meeting opportunity. And so, I would say, again, networking and building those opportunities out is a really important part of being successful.
All right, thank you guys so much. I want to thank our panelists today.